This week's Four Questions Journalist Spotlight is brought to you by Leff's Atlanta Media, Atlanta's best journalist database. Subscribe at leffsatlantamedia.com.
Welcome to the next edition of our Four Questions Journalist Spotlight. We are talking today with Rebecca Grapevine, who is writing for a new publication called HealthBeat. Hello, Rebecca.
Hey, Mitch. How are you?
I am good. I'm good. So you and I have worked together. You're a previous incarnation at the Atlanta Business Chronicle. And then I was excited to run into you at a Atlanta Press Club event a couple of weeks ago. And you said, "Hey, I'm back." I was like, "Wait, you're back?" I thought, yeah, she's back. So tell us a little bit about what is HealthBeat, and then we'll talk a little more about you too. But let's start with talking about HealthBeat.
Sure. Thanks for that question. HealthBeat is a new newsroom. We are focused on explaining public health to a wider audience. And we have a very local focus. So far we have two newsrooms, one here in Atlanta. You're looking at the newsroom, which is my home office, and one in New York City. We're part of a larger company, and this is also a collaboration with KFF Health News, or Kaiser Health News as it used to be known.
Right.
But super excited to be able to report on public health in Atlanta. Dream come true for me.
Well, there's a lot. I mean, and I guess what I wanted to kind of get a feel for is kind of what issues and topics do you want to cover? And then maybe as importantly, maybe to save you some headaches, is what do you not want to cover? So we can kind of get rid of all those people who are going to call you about topics that you don't want to talk about. So let's start with what you do want to talk about.
Yeah, no, that's such a great question. And I think in the public's mind, what is public health versus what is healthcare? It's not always easy to separate out, even for me. And I've thought a lot about it in this job. But we're interested in those systems, whether they're at the, local, the city, the county, or the state level, or even, occasionally the federal level, that are designed to help people from getting sick, or to help them have better outcomes if they do get sick. So really on that front end of prevention, which is a little different than kind of some of the healthcare I've done reporting in the past, more focused on, healthcare services. So just topics wise, things we're really interested in is obviously infectious diseases. What are the lessons we learned from COVID? How are we applying those here in Atlanta in case there is another pandemic or some kind of other infectious disease outbreak? But beyond the kind of traditional and, kind of exciting infectious disease angle, we're really interested in climate change. What impact does climate change have on public health? We're interested in how cities and counties in the state are preparing. We're interested in, prevention for chronic diseases. So hopefully that kind of helps people understand a little bit better what we're interested in. And we're, hey, this is our first week. So we'll be kind of, gaming that out as we go a little bit as well.
So where do people find HealthBeat? Is it?
Sure. It's healthbeat.org. Thanks for asking. One thing I'm thrilled about is, as a nonprofit news org, there's no paywall. It's free and open to everybody. We also have a free weekly newsletter. We would love it if you sign up. Just go to healthbeat.org and there'll be a link for you to sign up. And super exciting, our stories are available for republication. So people who work in other media outlets may want to pick up our stories and run them. And we welcome that. We would love that. So it's exciting to be back in the nonprofit world, because I want people to be able to read these stories without necessarily having to run into a paywall.
Yeah. So you can be another resource for local TV or other local digital publications that want to cover some of these health topics, but might have missed a story or might have not thought about the angle or the way that you're covering it.
This is my passion. I am here for those news organizations.
Well, I saw the story you wrote about. There was a COVID story you wrote the other day, and you must have talked to a dozen people for that story. There was a lot of sourcing in that one. I was like, wow, she talked to a lot of people.
Yeah, curiosity killed the cat and satisfaction brought her back. What can I say? But no, I love talking to people because plus it's a chance to learn about, you're working on one story, but you find out about other things that are happening. So, and if there's one thing I love, even more than public health, it's Atlanta. So getting to talk to Atlanta is exciting for me.
So, what would be an example of a health story that you'd be like, nah, that's not really what we want to cover?
Yeah, there are, sometimes stories that are more focused on like the wellness side of health in terms of, lifestyle type things or new products. That's probably not going to be something we're going to be able to cover. Like a new drug discovery, yes, we might be really interested in that if it's, impacting a health problem we have here in Atlanta, but the sort of wellness industry, that's maybe not so much for us. And, a lot of people, associate Atlanta with the CDC. We're really, really interested in the CDC. It's obviously like a hugely valuable resource for it. And it's the reason Atlanta's like the public health capital of the world. But I'm not going to be doing like day-to-day coverage of the CDC. Our partners at Kaiser Health News, which is now known as KFF Health News, are sort of, taking the lead on that. I'm going to be focused on the state and especially on, DeKalb County, Fulton County, Gwinnett County, the metro Atlanta area and what's happening right here in our community.
Okay, so you're going to be more Metro Atlanta focused, say, than Georgia focused.
Yes, to some extent, of course, it's hard to kind of separate the two.
Yeah, yeah.
And, a lot of the data will sometimes come down as Georgia specific because like, can any of us even agree where Metro Atlanta is? It's up for debate.
You have to talk to the Atlanta Regional Commission and see how they define the. Is it 14 counties or 22? Yeah, yeah.
But we're kind of going to start with this core, the traditional core Metro Atlanta area, and then kind of try to zoom out. But yeah. So if it's a story about South Georgia, that's probably not going to fit in our wheelhouse either.
Yeah. So I know this first week. So what have your stories been this first week so far?
So big shocker, public health reporter here reporting on COVID. And I should have a story out tomorrow, I believe, about a really cool marriage of the arts and public health. An art exhibit that was put up in East Point, Atlanta, that used art and photography to engage residents in public health. And that would be a story I love. I hope to continue about reporting on the intersection of the arts and public health because I think that's kind of a fun way for people to access like a serious kind of sometimes could be a little boring topic.
Okay. Yeah, it sounds like I always tell folks, if you're going to pitch a story to Rebecca, read the media outlet, see what she's been writing, see kind of how she writes, what she focuses on, what the topics are, and that might give some people some ideas as the weeks go on in terms of, oh, okay, I see kind of the trend. I see the flavor of what she wants to cover. That might give people some ideas and maybe not pitch, I've got a new yoga studio opening in my neighborhood. That's healthy, right?
Yeah, but one thing I will add to that too, Mitch, is like we're hoping to, besides my content, bring in some kind of first person voices, stories of people who work on the front lines of public health here in the city. So, somebody who has a lot to say on the matter would definitely potentially be a good pitch. Still getting up and running, so don't get impatient, but that's something we're definitely working towards. And can I say one more thing?
Sure.
We are trying to build this very community driven model of reporting. So you'll see me out at events. And, we want to hear from people like, what are their concerns about public health? Are they worried about water, for example, in Atlanta? Or are they worried about, asthma? Let's hear what people are actually concerned about.
Yeah. I mean, there are certain things that pop up kind of certain times of the year. Asthma season, flu season. I mean, this fall, I think it's probably going to be a busy time for you as flu shots or COVID and seasonal flu shots come out in the fall. And I think what was a ridiculously low number of people who got their COVID boosters last year? Was it 22% or something like that? It was something very low.
Very low. Although, to very low number of folks who were totally updated with the, last year's COVID shot. Although more people in Georgia, I looked at the numbers, had originally gotten like 1 or 2 shots. So the interest was there, and it seems like it kind of fell off. Maybe
Well,
over.
yeah. Well, as with anything, it's like if you see lots of people getting sick from COVID, they're like, oh, I should get the shot. But then, so then lots of people get the shots and fewer people are getting sick. And then people think, oh, nobody's getting sick. I don't need to get the shot. Right. Which is
Yeah,
not
a
not
little
good
bit of a
logic.
conundrum.
Not good logic, right? The reason
True,
they're not getting sick is because they're getting the shot.
but as a PR professional, word of mouth is always the best, right?
Yeah, yeah. And sometimes yeah. And yeah, I agree. I agree. So obviously that's going to be big for the fall. Are there some other topics that you're thinking about over the next couple of months that you think, okay, you probably have a long list already since you're just getting started of things you want to tackle, but are there some other topics that you think I want to get this or this?
Absolutely. And we mentioned asthma. Any impacts of heat on folks? Well, it's still unseasonably warm here in Atlanta. Um, Looking at some STI stuff. So whether it's HIV, Atlanta has high rates of HIV, or syphilis. Looking at new developments in like drug use, and that could be things from like illegal drugs, like meth or opioids, but also kind of this new frontier of, when you go to the gas station or you're driving around town and you see so many different drugs that, frankly weren't around when I was growing up. And so what are those, and why are they so popular all of a sudden? Do those pose risks to folks? That's kind of something I'm interested in because frankly, I don't know the answer to those questions.
Things you can buy at the gas station that you probably shouldn't. Yeah.
Hey, I'm not here to judge. I'm just a reporter.
Well, I mean, there've been a lot of stories about that. Some of those things they're not FDA approved because they're not defined as drugs. They're defined as, I don't know, some sort of supplement or something, and no one knows quite what's in some of those packages, right?
For sure. Kind of trying to understand what's going on there. And even, like there's obviously a lot of talk among celebrities and on social media around like using psychedelics and stuff like that. So I don't know a ton about that right now, but it's something I want to take a deeper look at.
No lack of story ideas, right?
No lack of story ideas in the public health capital.
Yeah, yeah. Well, yeah. You got CDC and Emory and lots of hospitals here, and
Georgia State has a great public health school as well. Morehouse School of Medicine.
yeah, and some good nursing schools in Metro Atlanta too, right? Well, and in Georgia too.
Yes, and nurses and sort of frontline public health workers are definitely a key audience group for us. So that's, in terms of thinking about pitches, that's something people could note.
Okay, I'll have to share this with the folks at the nursing school over at Emory. They're got some good folks over there too. All right, so let's get into the fun and challenging questions. So sometimes the hardest question I ask is this question, which is, what's something cool or fun about Rebecca that folks might not know?
Well, it may not be the best kept secret, but I do love the cultural art scene, shall we say, in Atlanta. So I have FOMO. You won't, if there's an event around town, I love to go out and be there. I consider it, part of my like mental health to go out and have fun because what I do is very serious. But I also feel like I always get a lot of good story ideas when I go to an event. So I'm planning on this Sunday to go to House in the Park and partake in that grand Atlanta tradition. But you're just as likely to find me, at the symphony. Next week, I'm going to the Alliance to see a play. So living in Atlanta is such a privilege, and I try to take advantage of it.
And I should have asked you, kind of popped this part of the question earlier, but you've got some legal background too, right?
Well, I'm not a lawyer, so don't hold that against me. But, yeah, I before I was a journalist, I did a Ph.D. in legal history from the University of Michigan. So I have spent a lot of time in a law library, and I like law and policy stuff. So you're spilling all my secrets, Mitch.
I remember we talked about that before, and I thought when you were at that other local newspaper. I thought it was fascinating that you had, I think you were covering health issues, but you had such a strong knowledge of the legal side of it too, which is kind of a not always a combination that we see in journalists who have, that legal piece of it, and I think it flavors your reporting and adds a bit to it too, having that aspect of it. Okay, so lightning round, maybe not so lightning. What is, and you can answer one or both of these, the last book you've read or the last podcast you listened to?
Okay, last book I read, I gotta go with Where Peachtree Meets Sweet Auburn. Nonfiction, classic book about Atlanta that I had never read. It's nonfiction, but it reads like a novel. And if you haven't read it and you live in Atlanta and you claim to love Atlanta, then you can go get a copy from, a local bookstore right now. Probably one of the best history books I've ever read. And I've read a lot since I have a PhD in history. So
okay. All right. Favorite local restaurant?
Ooh, that's tough. How about the General Muir?
Ooh, good choice.
Yes.
All right. What's your go-to dish there?
Oh, go-to dish. It's a tie between the bagel with smoked salmon or the bagel with the smoked trout salad.
Ooh, okay. Yeah. Both of those sound good. All right. Favorite guilty pleasure?
Okay. Even though I'm very social and like to get out, my guilty pleasure is to like curl up on the couch and just, spend all afternoon reading and kind of turn off my phone and just dive into a book, take a nap, read some more.
That is a good hobby. Okay. So, and this is similar, but do you have a kind of a non-work hobby that you enjoy?
That's a good question. I think I should try to find one that's not reading or socializing. But I will say, my lovely mother lives here in Atlanta as well, and so we often, we'll travel together, hang out together, sometimes watch movies together. I don't know if hanging out with your mom is a hobby, but it is a special treat for me.
Yeah, that's a good thing. That's a good thing, hanging out with your mom. Last one of these questions is, what's your favorite kind of local getaway? Somewhere, let's say in Georgia, where you like to go to escape, other than your couch.
No question. Hands down, Savannah. Got a, great culture, tons of history. You're by the beach, amazing seafood. Is there anything more that you could want in this world?
Savannah is a good one. I favor a little bit further down the coast in St. Simon's a little bit, but just a little quieter sometimes than Hilton Head or Savannah. But yeah, Savannah's great, and the history there is really incredible. All right. So anything else about HealthBeat? And let's give the website again for folks who might not remember it from 5 minutes ago.
Sure. It's just healthbeat.org, all one word. If you click over there, we've got, a way for you to sign up for our newsletter. We've got a survey for you to fill out. We've got our Atlanta page. You can find our socials. So really excited to kind of get the newsletter up and running and see how many folks in Atlanta we can get reading our stuff.
And if you're listening and you're with another local media outlet, call Rebecca and you can get to use her content.
Yes,
she won't even charge you anything for it. Oh, that's a deal. I don't know. Maybe they should put you on TV or something. You want to be a health reporter on TV too?
I would love to do TV spots. Or radio. I love broadcast. I'm a print reporter first and foremost, but happy to get in front of the camera.
I think some of the TV stations need a regular health segment.
I think that's a great idea, because one of the things we're trying to do is build, a trusted source of news for people. There's a lot of health information out there, but we want to be the kind of go-to who has access to the experts and, introduces some new ideas to folks as well.
Very good. We have been talking with Rebecca Grapevine, who is the new Atlanta reporter, the inaugural reporter for healthbeat.org. Go to healthbeat.org. Did I say that? Healthbeat.org? Should I say it again? Healthbeat.org. And check it out. And As always, you can find our archive of journalist spotlights on YouTube or on anywhere on audio where you find your favorite podcasts, Apple Podcasts or Spotify or iHeartRadio or all of those things. So check it out and click that subscribe button and share it with your friends. And as always, if you're looking for our database of Atlanta media, go to www.leftsatlantamedia.com and sign up for that, and you'll get the database, and you also get access to our monthly Mitch's Media Musings newsletter that has all kinds of interesting and useful information, like, hey, check out Rebecca Grapevine and the new publication she's writing for, which was in our last issue. Very good. Rebecca, thank you so much.
Thanks, Mitch. Appreciate it.
Take care, everybody.